Hello and welcome. Today we're diving into the complexities of a rare autoimmune disorder called Cogan syndrome. This disease primarily affects the eyes and inner ears, leading to a range of challenging symptoms. Join us as we explore its cause, effects, diagnosis, and management. Unfortunately, the exact cause of Cogan syndrome remains a mystery. It's considered an autoimmune disease, meaning the body's immune system mistakenly attacks its own tissues. What triggers this immune response in Cogan syndrome is still unknown. Research suggests that genetic predisposition, environmental factors, or even prior infections might play a role in its development, but further investigation is needed to pinpoint the precise origins. The pathophysiology of Cogan syndrome involves inflammation of various tissues in the eyes and inner ears. In the eyes, this inflammation often targets the cornea, the clear front part of the eye, and the sclera, the white part. This can lead to conditions like keratitis and scleritis. In the inner ear, inflammation affects the structures responsible for hearing and balance, leading to symptoms like tinnitus, vertigo, and hearing loss. The immune system's attack damages these delicate tissues, disrupting their normal function and causing the characteristic symptoms of the disease. Cogan syndrome is a rare condition. Precise epidemiological data is limited, making it difficult to determine its exact prevalence. It affects both men and women, typically appearing in young adults, usually between the ages of 20 and 40. Due to its rarity and the similarity of its symptoms to other diseases, diagnosis can be delayed, further complicating epidemiological studies. The signs and symptoms of Cogan syndrome can vary significantly from person to person. Eye-related symptoms often include redness, pain, blurred vision, light sensitivity, and a gritty sensation. These can manifest as keratitis, scleritis, or even uveitis. Inner ear symptoms include tinnitus, ringing in the ears, vertigo, a sensation of spinning, hearing loss, and a feeling of fullness or pressure in the ears. In some cases, Cogan syndrome can also affect other organs, leading to symptoms like fever, fatigue, joint pain, and even cardiovascular complications. It is important to remember that not all individuals will experience all of these symptoms. Diagnosing Cogan syndrome can be challenging due to its rarity and the overlap of its symptoms with other conditions. Diagnosis typically involves a combination of clinical evaluation, eye examinations, hearing tests, and laboratory tests. An ophthalmologist will perform a thorough eye exam to look for signs of keratitis, scleritis, or other eye inflammations. An audiologist will conduct hearing tests to assess the extent of hearing loss and balance problems. Blood tests can help rule out other conditions and identify inflammatory markers that may support the diagnosis. Confirmation of the diagnosis may require a biopsy of the affected tissues. While there aren't distinct subtypes of Cogan syndrome, it's often categorized into typical and atypical forms. Typical Cogan syndrome involves the classic combination of inflammatory eye disease and audiovestibular dysfunctions, inner ear problems. Atypical Cogan syndrome may present with other systemic manifestations, such as involvement of the heart, blood vessels, or gastrointestinal tract. These atypical presentations can make diagnosis even more challenging. The treatment of Cogan syndrome focuses on controlling inflammation and managing symptoms. Corticosteroids, such as prednisone, are often the first-line treatment to suppress the immune system and reduce inflammation. Immunosuppressant medications, like methotrexate or azathioprine, may be used in more severe cases or when corticosteroids are not effective. For eye symptoms, lubricating eye drops and other topical medications can provide relief. In cases of significant hearing loss, hearing aids or cochlear implants may be considered. Regular monitoring by an ophthalmologist, audiologist, and rheumatologist is essential to adjust treatment as needed and prevent complications. Currently, there is no known way to prevent Cogan syndrome. Because the exact cause is unknown, specific preventative measures are not available. Early diagnosis and prompt treatment can help manage symptoms and prevent long-term complications. People with a family history of autoimmune diseases may be at a slightly increased risk, but this has not been definitively established. The prognosis of Cogan syndrome can vary widely depending on the severity of the disease and the effectiveness of treatment. With prompt and aggressive treatment, many individuals can achieve remission and maintain good vision and hearing. However, some individuals may experience chronic symptoms or develop long-term complications, such as permanent hearing loss or vision impairment. Recent research has focused on identifying specific biomarkers that can help predict disease progression and response to treatment. Additionally, studies are exploring the potential of targeted therapies that can selectively suppress the immune system without causing widespread side effects. Further research is needed to improve our understanding of Cogan syndrome and develop more effective treatments.